As if a cancer diagnosis isn't devastating enough, many patients simply can't financially afford the fight. A new study finds 1 in 3 Americans on Medicare and who do not qualify for low-income subsidies do not fill prescriptions for their cancer drugs because of the soaring costs. NBC News health medical reporter Berkeley Lovelace Jr. joins us now. Berkeley, this is a pretty devastating prospect. I mean, people not even be able to afford those drugs. How much are we talking about here? I mean, what are we hearing from those cancer patients who are forced to make that decision?
Yeah, so as you said, drug prices are extremely high in the United States. And on top of that, many Medicare beneficiaries don't qualify for these low-income subsidies. One patient I spoke with, her medication cost about $16,000 a month. Medicare does pay for some of that, but she still has to shell out about $12,000 a year to be able to afford her medication. In other cases, some patients have to shell out nearly half their gross income. And in those cases, it's really a situation of being able to pay for your groceries or being able to pay for your cancer medications, Morgan.
But, you know, I mean, you said something key there at the beginning. You said here in the United States, these drugs are so expensive. So what exactly makes these drugs so expensive, especially when you compare them to other developed nations?
Yeah, that's a really great question. And so one problem may lie in the Food and Drug Administration's accelerated drug approval program, which allows these drug makers to get the drugs onto the market faster, but with less data than they normally are required to get to show that they're highly effective. And so in some cases, these drug makers will charge their drugs at tens of thousands of dollars a month, which is affordable for many people. And other experts say there's problems with our own policies. And so one proposal would allow the federal government to negotiate drug prices on some of the highest drugs on Medicare, which proponents say would lower the out-of-pocket costs for beneficiaries. And then another proposal would just limit the amount of money that patients can spend at $2,000. And so Congress is pushing a number of these proposals, but it's still unclear yet whether they'll be able to get it into law, Morgan.
All right, Berkeley Lovelace Jr. Berkeley, thank you so much. We appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.